Hi guys, I'm Dr. Donahoe. I'm trying to shoot this video today to sort of expedite new patient appointments with regards to those children that need attention for oral tethers or lip and tongue ties. This is really all about giving you as much education in a short period of time as we can so that we can make your follow-up, or your initial appointment I should say, a quick one. This will allow us to accommodate patients as needed to get this work done as soon as possible, rather than having to schedule a full 1 hour new patient appointment for every one of these lip and tongue tie cases. So what I'm going to do is basically discuss a little bit about chiropractic, what chiropractic is and how we work with our patients, especially the little ones, and then specifically how it applies to lip and tongue ties or oral tethers. And then we're going to talk about cranial work and how important that is with the work that we do as well. So let me just begin with some basics on chiropractic. Chiropractors are physicians that specialize in neuromusculoskeletal injuries or conditions. That's nervous system, muscular system, and skeletal system. It's important to understand that those three are very interconnected. The nerves tell the muscles what to do, and the muscles move the joints, and the joints can in turn create abnormal stress on the nerves, and then we create this cycle of dysfunction where the nerves aren't working right, the muscles aren't working right, the joints aren't working right, and around we go, and we see a series of dysfunction problems in any patient. So chiropractic is appropriate not only for adults and older children and senior citizens, but also for infants. The simple matter of being born is one of the most stressful events that any individual will ever experience, and so it's really essential that we assess all newborns for the presence of any compromise structurally or neurologically. What we talk about in chiropractic is simply known as a subluxation. This is the root of what we're assessing from a structural standpoint. So I want to define what a subluxation is for you. So I wrote down the word here. It sounds kind of scary and even looks kind of scary when you see it in writing, but we're going to break it down today and make it really simple to understand. So the root portion of this word is luxation. Luxation is the medical word that simply means dislocation. And most people know what a dislocation is. So a joint injury that's usually a result of a traumatic injury results in complete displacement of that joint. In other words, bones are not touching anymore. The joint is out of socket, if you will. And luxations are not chiropractic cases. That's an orthopedic emergency. In chiropractic, we focus on subluxations. And sub is a prefix in the English language. It means less than, beneath, or under. We see it in words like subway, submarine, or subtract. So what this word here means is literally less than a dislocation. So that's a subluxation. It's not a complete out-of-socket joint. Essentially, it is a joint that is misaligned or less than dislocated. So for a visual example that you can kind of take with you, I'm going to show you using my hands. Two bones come together to create a joint, and this can be any joint in the body that's vulnerable to the development of subluxation. This would be a luxation, complete dislocation of the joint. The bones are not touching anymore. It is out of socket. Again, this is not a chiropractic case. This is an orthopedic emergency. In chiropractic, we work on less than dislocation or subluxation. It's a misalignment of the joint. The bones are still touching in that joint, and the joint is still functional, but it's abnormal in its alignment and function. This is what results in all kinds of problems, pain among them. But this is also why chiropractors make adjustments. We're going to restore the proper alignment by moving that bone back into the correct position and restoring normal joint function. Now, what's important to understand about a subluxation is it is what is responsible for creating that subtle nerve irritation. Understand basic human anatomy is that we've got a skull or cranium and 24 vertebrae in our spine, and in the base of the spine is the tailbone or the sacrum. Now, the movement of all of those vertebrae in the spine is essential for proper spinal cord health, as well as spinal nerves, which branch out in between every single one of those vertebrae, top to bottom, from the base of the skull to the tailbone. So subluxations, as they affect the spine or the cranium, can really seriously have a negative effect on the nervous system and how it's trying to do its job. Remember, nervous system controls and coordinates every single function in the body. So when there's a compromise to that nervous system, we're going to see some degree of compromise in the body, whether it's a muscle that's not working right or an organ system that's not working right. It all comes back to stress on the central nervous system. So chiropractors overall are really more appropriately called nervous system doctors. That's always our primary focus, to enhance and remove any potential irritation from the nervous system so that it does its job the way it was intended to do and controls function throughout the body. So that's the basis of what chiropractors do, is we identify and correct subluxations. All right, so regarding different techniques within the profession, what we utilize here at Donahoe Chiropractic is the unique combination of activator method chiropractic technique as well as neurocranial integration, or NCI. So first let's talk about activator technique. First of all, we got to be able to find these subluxations in even these smallest patients, and that can be pretty difficult sometimes. It's easy when parents can say, or adults can say, my neck hurts right there. We don't get to hear that from babies. So what we have to be able to do is investigate this little tiny body and find these subluxations without their input. And that's what's really important to understand, is that our examination is what we call a neurologically based examination, which means we're actually testing the nervous system to identify where there's some degree of compromise. This allows us to really effectively identify exactly where this patient needs to be treated, and also, just as important, where they should not be treated or adjusted. So we're going to use this leg length analysis, as it's called, to identify where there are problems in the structure. And leg length analysis is what we call a reflexive type of testing. We're actually stimulating neurological reflexes throughout the examination. So most people are familiar with what deep tendon reflexes look like. You tap a knee and the leg jumps, you tap an elbow and the arm jumps. So what we're doing is something like that. We're tapping into reflexes. The reflex that we're looking for is called a guarding reflex. And as the name implies, the body is trying to guard or protect against something, and that something is the stresses that we introduced during the examination. So what we're doing is actually called leg length analysis, and throughout the examination, we're going to be introducing stresses, physical stresses, and I'm doing those myself. Just a little bit of finger pressure on a specific joint or specific muscle, that's a stressor, believe it or not, and we're looking for how the nervous system responds to that stress. What we're looking for is evidence of this guarding reflex, that contraction, if you will, that occurs during the guarding reflex. And we can see that as muscle tone changes in the legs that actually create a subtle leg length change or difference. So what we're going to do is introduce a stress and then check the leg length. And we can see and feel muscle tone changes if the guarding reflex is initiated, and we'll be able to identify that very clearly. But it only turns on that guarding reflex if we introduce a stress into a joint that is subluxated or a muscle that's already too tight. If we test a normally functioning joint or a normally functioning muscle, we'll not see evidence of the guarding reflex, we'll not see any change in muscle tone or leg length. We know that it's a negative test and an area that we're going to leave alone. Then it comes time to making the adjustments, and most people think about chiropractic and think about manual adjusting or adjustments done by hand. And those can be a little bit rough sometimes. They're generally very, very safe, but they're certainly not in the best interest of our littlest patients. And so when I was in chiropractic college a long time ago, keep in mind I did graduate in 1997, I started looking at low force adjusting techniques because I knew I was going to go on to specialize in pediatric care. So I studied every low force technique that the chiropractic college I attended offered, and I came away with what's known as activator method chiropractic technique as my technique of choice, because of the neurologically based examination and the use of an adjusting instrument to correct any and all subluxations. This is an activator version 5 adjusting instrument. It's an electronic instrument with a simple button that we press that delivers a thrust through the small rubber tip on the end of the instrument. It's got settings 1 through settings 4 on the instrument. Setting 4 is a higher force, which is reserved for the adult pelvic joints and adjusting those, while setting number 1 is how we adjust infants in the office. So it's a variable force, understand that. The instrument looks and sounds like this when it makes an adjustment. You'll watch my finger just bounce a little bit. Little thump right there. And with that thrust, we move a bone. That's how we correct subluxations. So the examination tells us where a patient needs to be adjusted, and this is exactly how we go about doing it. A very safe, very specific, very gentle, and effective way to adjust the spine or extremities or cranial sutures in these newborns. Now we're going to talk about neurocranial integration. This is actually probably the most important thing that we're going to do with these kids with oral tethers. What we are addressing with neurocranial integration, I'm just going to say NCI from now on. What we do with NCI is we address what's known as intradural tension. Now, the dura is the connective tissue that runs from the skull over the spinal cord and brain all the way down to the tailbone. It's called the dura mater. The dura mater is one of the 3 meninges. The meninges are the layers of protective coverings of the brain and spinal cord. You've probably heard the term meningitis before. Meningitis is infection or inflammation of the meninges. The dura mater is the outermost covering of the brain and the spinal cord. Inside the structure of the skull, the cranium, the dura mater is the outermost wrapper of the brain, but it is also directly attached to the interior of the entire cranial vault. So all of our cranial bones, there are 22 in number, are directly attached to this dura mater which wraps around the brain. And what ends up happening here is the dura mater, if it has any potential twisting or torsion or tension in it, is going to adversely affect the cranial joint motion as well as influence the entire length of the spine, top to bottom, and even influence the pelvis. Remember, we're talking about the wrapper of the central nervous system, the outermost covering of the entire brain and spinal cord. So what we do with NCI is we specifically address intradural tension or abnormal tone within the dura mater, and it is essentially a stretching technique. We're going to remove that abnormal tone and tension by stretching it out. So it's not what many people think of when they think of cranial therapy. They think of commonly craniosacral therapy. There are other cranial techniques as well. But what we're doing is NCI. It's a little known therapy. It's fantastic though in its ability to specifically treat the entire structure and neurology of the body in a very short period of time. In fact, the release procedure is a two-step procedure which takes about 1.5 minutes to perform beginning to end. Very short, but very, very powerful and effective. So how is NCI actually performed? Well, as I mentioned, it is a stretching technique. So typically patients will lie on their back. I'll stand behind them at the head of the table, and I simply raise their head up off the table. Now, it is a two-step procedure. We're going to be releasing the right side of the body as well as the left side of the body, so we're going to do 2 stretches. We're going to rotate the head around just a little bit. We're going to anchor the shoulder down, and then we stretch. In older children and adults, this takes about 30 to 40 seconds. We release the one side, then we do the same thing on the other side. Now with our infants, it doesn't take quite as long because they have faster cranial joint motion, which allows us to cut the duration to only about 20 seconds on each side. So we're really looking at a procedure that takes less than 1 minute to perform with our little infant patients. It is a painless procedure. In fact, it feels pretty darn good. Sometimes our infant patients, though, they try to tell a different story, you know how they can be. So they start to get a little upset, but it's usually not because it's uncomfortable. It's because along with this procedure, they have to be held down on the table. So we have mom or dad apply a little bit of pressure on their chest and shoulders to keep them flat, while I use 2 hands to lift and perform the procedure. It's completely painless, but as I said, sometimes they tell a different story. But it's the only way that infants have to communicate, I'd rather not be doing this right now. So sometimes they get a little worked up and they kick and they scream and they cry, but it's not painful. It's simply their only way of saying, I don't want to do this right now, thank you very much, but we're going to do it anyway. So it's a very simple procedure to perform, but has profound effects structurally and neurologically. Okay, now that you understand a little bit about chiropractic, about activator technique, and also about neurocranial integration, we're going to get into what we're actually doing for these oral tethers, these lip and tongue tie issues. So understand that lip and tongue tie issues are what fall under a broader category of midline defects, and they contribute to or a part of midline tension. So we're talking about midline defects and tension that originate here and travel through the entire body. In fact, I watched a video just the other day, thanks to Kristen, that was an amazing dissection video that showed the direct connection of the tongue through major muscles of the body, the attachment and covering of the heart, major muscles in the lower back, in fact, muscles that run all the way down to the tips of our toes. Very fascinating stuff, but it is a very, very important connection that people need to understand. Oral tethers don't stop here. We're talking about tension that runs from beyond the mouth all the way down through the body to the tips of the toes. So it's something that's really, really important to release, not only inside the mouth. Of course, we may need to have a release procedure done. So we refer to pediatric dentists or ENTs who do this kind of work, the actual release procedure. But it's important that you understand we need to do a lot more than simply release the tongue or release the lip. We have to address this tension that exists along the midline of the body from top all the way down to the bottom. So what we're doing with NCI is we're addressing that intradural tension. It's important to understand that this tension that runs from top to bottom often creates a situation in this child where not only do they have the oral tethers, but this is also a child who may have problems with reflux. A lot of times we see this oral tension is going to show up down into the stomach. What ends up happening is it pulls the stomach up towards the upper part of the body, and that is going to cause problems with where the stomach lies and interfere with the valve and how it basically keeps things in the stomach. There's a sphincter valve in there. If that sphincter valve is being overpowered by the tone and tension within the diaphragm and the stomach, we're going to see leakage and we see reflux. So it's very common for babies with oral tethers to be gassy because they're getting a lot of gas in when they nurse, but they're also going to have the potential for reflux to be a problem. Beyond that, we also see lots of other things that can be related to this. I'm not going to go into great detail on that, but one of the very common things is babies don't like to be in tummy time or in their car seats. And this is again due to this midline tension typically affecting the front side of the body. So what we see is that babies are typically C-shaped. From their base of their skull to their tailbone, their spine has one big curve, a C-shaped curve. And what we find is if this tension is increased on the front side of that C, when we try to straighten them out, they don't like it too much. So imagine laying on your belly and lifting your head up, you're reversing that C, and they don't like that. So we find the babies that have this midline tension and oral tethers often don't like tummy time very much, and they also don't like car seats because we do the same thing we put in their car seat. We anchor their hips and pelvis down and we strap their shoulders back and we put them into this straightened out position. They tend to not like it a whole lot. So it's important to understand that these midline tension issues are far further reaching than just what we see in the mouth, okay? So what we're doing with NCI is we're specifically addressing that midline tension. We're going to stretch and release that tone and tension. All right, so let's talk about preparing for the oral release procedure. It's important that we set the stage correctly. We want to make sure that that body, that mouth, is ready to receive the release procedure that's performed by the ENT or the pediatric dentist that does this procedure. So what we're doing is physically releasing this tension. Remember, we've been talking about how much tension there is through this midline. It's important that we address some of that. So before your scheduled physical release procedure to release that tongue or lip or even the buccal ties, we need to address this midline tone and tension. We want to get these babies in just a day or two before the actual release procedure is performed. We need to prepare this body to receive that release procedure. Sometimes you use the analogy of a rubber band. If you imagine taking a thick rubber band and stretching it tight and then having to cut it, that thing's going to snap a little bit once it's released. But if you take that same rubber band and you release the tension on it and then you cut it, it just flops right down. We don't have the snapping taking place. Kind of the same concept with regards to these oral releases. We want to prepare by softening up that tension so that the release goes smoother for the doctor who's actually performing that procedure. And then after the release is performed, typically within a few days we want to do a second cranial release. It's important that we address any potential tone and tension issues that develop as a part of the actual release procedure being performed by the ENT or pediatric dentist. Bottom line is that your baby is going to be much more comfortable when they receive this procedure if we prepare their body and evaluate it after the procedure. They're going to do much, much better in their recovery, I promise. Okay, so now you all understand the importance of chiropractic care in general. You understand what a subluxation is. We've talked about the techniques that we utilize, activator method, chiropractic technique, as well as neurocranial integration. You understand how it specifically applies to your child's case with their oral tethers. We've given you a good explanation and even a demonstration of what NCI looks like. So I think that the best way we can wrap this all up is just by saying this video does take the place of about 20 to 25 minutes or so of personal one-on-one education time. So we do as much as we can in this video in order to make the visit more accessible so that we can get your child in as quickly as possible. We should have about a 10-minute appointment rather than a 45 to 50-minute long appointment if you guys have been paying attention to what we're talking about in this video. We're pleased to be able to offer this service because we know that it's so important that these children with oral tethers get this thing corrected as soon as possible. And we understand how important it is that you get to be successful in your nursing experience with your baby. We are huge proponents of breastfeeding, and we don't want these children to suffer in any way. We want you to be as successful and to nurse as long as you possibly want to. Keep your child at your breast. Extended breastfeeding, 2, 3, 4 years, go for it. We're big proponents of making sure you nurse as long as is important for you and your child. We are very happy to be a part of the team that's going to be helping your child and your breastfeeding relationship be as successful as it possibly can be. And remember, this team is a big one. We've got you and your baby, we've got the lactation consultant, we've got your pediatric chiropractor, you've got your pediatric dentist. We've got a great network of people that are working to support you, and I'm very happy to be a part of that team.